Hello and welcome everyone. Thank you for joining today's presentation from the Health Connector. Today's presentation, titled Make Updates, Change Plans, and Shop for Health Insurance this Open Enrollment, is an opportunity to learn about your options for 2023 Health Connector coverage and how to make updates and changes during Open Enrollment. We have a number of participants who have signed up, but we will get started at noontime today as scheduled. I'll just give a moment while people join. Hello and welcome everyone. I'm Erin Ryan from the Massachusetts Health Connector. I'll be facilitating today's session. I'm joined by my colleagues, Nikki Conti and Melissa Montrand, who will be presenting today's information. And we are here to help answer any questions you might have. I would like to take a moment to thank organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation and demonstration portion will last approximately 40 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A functionality. We will be monitoring your questions throughout. Please, however, do not disclose any personal information or protected health information when you ask your question, as others on the call are able to see what you've written. If you have a particular personal scenario that you would like to discuss with someone, we'll be providing contact information for Health Connector's Customer Service Center and instructions on how to find help from a local navigator. Also, we are recording today's webinar. Following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. So again, thank you for joining the Health Connectors webinar, and we will go ahead and get started.
Thanks so much, Erin, and thank you everyone for joining us today. So as Erin said, today's presentation is all about Health Connector Open Enrollment. We're going to talk about what that means. We'll also share some information about how to make updates, talk a little bit about changing plans, and show you some of the tools that are available on the Health Connector's website to help make this year's shopping and enrollment experience a little bit easier for you. So as we dive into the presentation, this is particularly what I will cover along with my colleague, Melissa Montrand. So I'll talk a bit about what the Health Connector's Open Enrollment is. We'll spend some time on what you need to do and how to update your online account. We will talk about what's new for 2023 coverage, and then show you how you can compare your options and potentially save some money on your coverage beginning in January 2023. And then lastly, of course, we will show you some information on how to get help from a local navigator or Health Connector's customer service. So before we go into what the Health Connector's Open Enrollment is, I just wanted to take a moment to explain, what the Health Connector is. So we are the state's health insurance marketplace. We offer coverage for individuals, families, and small businesses. And basically, the health insurance that is available here is for people who don't otherwise have access to coverage, either through their own job, through a spouse or a partner's job. And we're really happy to say that many people who apply for coverage through the Health Connector get help paying for that coverage. So they're not paying a full premium due to different type of savings that are available because we are a state marketplace. Couple of other things to note on this slide. People can also buy dental insurance through the Health Connector. So that might be something that as you're thinking about what your options are, what you would like to do for plan year 23, you might also be comparing dental coverage. And then lastly, I want to mention that we do have another platform that we're responsible for. It's called Health Connector for Business. And Health Connector for Business is employer coverage specifically for small employers with less than 50 full-time employees. So that's a way that small employers can offer coverage to themselves as well. Their owners can offer coverage to themselves as well as their employees. So if anyone is interested in learning more about Health Connector for Business Or if someone on this call isn't already a Health Connector member and you're interested in just learning how you might become a member, we have other resources available on mahealthconnector.org. In our resource download center, which is available from our homepage, you can go to our video library and see past recordings of some general presentations. You can also go to the Health Connectors YouTube page and watch past videos to learn a little bit more, either about Health Connector for Business or just general information about what the Health Connector is and our different offerings and more details. So today's presentation, really our target audience is anyone, you might be a new member, you may have been a member for a couple of years, and you may just say like, maybe here just looking to get a little bit more guidance about open enrollment and what that means for you. So here, I just want to point out that open enrollment began actually November 1st, and it will run this year through January 23rd. That is our typical open enrollment cycle. And then beginning on January 24th, that's when we get into our closed enrollment period. So what does that really mean? So for those of you who are members, or if you know someone who doesn't have coverage for any reason, it's the time of year when you can apply for coverage for the coming year, or you can renew your coverage or shop for a new plan for January 1. Really, it's the time where you can review all of the available options on our website. And, you know, if you want to stay with the coverage that you have, we'll talk about that. There's very little that you need to do if you're fine with the coverage you have. But we really do encourage anyone who is a current Health Connector member to take a look at their application, take a look at their coverage, and just, you know, do some comparison shopping to make sure that the plan that you're going to be enrolled in beginning on January 1 of next year is where you want to be. When we are outside of open enrollment, or we're in a closed enrollment, people need a qualifying life event to access health insurance coverage. So these are things like, you know, getting married, having a child, losing job-based health insurance. So it is really important that if we are outside of open enrollment, if you have one of these qualifying life events, you come to the Health Connector and you report that within 30 days of that thing happening. A person will have 60 days from the date of the qualifying event to select a new plan. And when you're kind of in this special enrollment period, our payment and our enrollment deadlines are still applicable. So let's talk a little bit about the health insurance plan renewal. So why do we do this? So this is a process that the Health Connector runs every year before open enrollment starts. And these processes let members renew into coverage beginning the first day of the new year. So it's an automatic process. And what happens essentially is that people get mapped, everyone in your household gets mapped to a plan in 2023 based on the plan that you're enrolled in 2022. So we try to make this easier for people to renew their plan. As I mentioned before, if someone likes the plan that they're currently enrolled in, all you need to do is pay your monthly premium by December 23rd. If somebody wants to shop, or for whatever reason they don't like the plan that they're in, they can shop for something that is a better fit. Now, if you are shopping and you choose a new plan, you have to enroll and pay the monthly premium by December 23rd, so that you can be, it's called effectuated, but essentially it's so that you're successfully enrolled in the plan for January 1. Okay, so let's talk more about what you need to do and how to update your online account. So I mentioned that these are annual processes. We have a pretty detailed timeline here at our organization. There are things that we do in August and September. you start hearing from us sometimes in late August, sometimes early September, but through October, when you get what's called a preliminary eligibility notice. And there are instructions in there that say, it's time to take a look, update your accounts. And the reason we reach out to you at that point is because in the month of October, we use the latest information that is available to us to calculate what your final renewal notice is going to say. So in November, as a member, you get your final renewal notice, and beginning on November 1, you have the opportunity to shop. Now, December is really important because, as I mentioned before, the premiums for January 1 coverage are due by December 23rd. So if you want to make any changes, again, you need to shop and do all of that by December 23rd so that you can be effectively enrolled in coverage January 1. Now, how do we reach out to people? Because we know, obviously, in today's world, we get things in the mail, we get emails, we've got all kinds of communications, but we want you to know which methods we particularly use so you know it's us. So there are formal official notices, legal notices that we need to send you. So that's your preliminary eligibility notice, your final eligibility notice. So those are things we mail to you. Then we also send emails just to remind you about open enrollment and particular deadlines. So you'll probably get an email from us around the December payment deadline. So that's the type of thing you can expect to hear or get from us. Our customer service center also does conduct robocalls during this time to just remind people about open enrollment. So if you are a member, you may get a robocall from our organization. Now, another method that isn't listed here, but I want you to know about is text messages. We just recently implemented this ability to send text messages to members. And that is something that if you had reached out or you do reach out to our customer service center, customer service representatives will ask you about that and ask you if you want to opt into text messaging. So just want you to be aware of that. Also noted on this slide, members can access, basically you can download and print any of your notices from your member portal, meaning your online account. So if you're interested in doing that, no, you can go paperless. I'm not sure whether or not your legally required notices you can do that for those, but for other items you can go paperless, like for billing and things like that. If you're interested in learning about the member portal, go to our website, mahealthconnector.org, and you can find some more information about the portal there. So on this slide here, I won't go into too much detail about what the text is saying, because I think we've already covered it. But what I do want to show you is that this is a sample notice. This is what a sample renewal notice looks like. So your name would be listed, whoever your head of household is, that would be displaying on the screen, on your letter. And then we have some instructions here about what you need to do. We remind you of the important dates. And other things that are included on this notice are the plan that you're going to be renewing into beginning on January 1, as well as what your new monthly premium will be if there was any change to that monthly premium. Now, there are other types of communications we send. I told you we've got the legally required things. However, we also send other like flyers and inserts, so you are aware that open enrollment is about to start or that we are in open enrollment. Most of this information comes to you in English. Some of the information may be, in this case, it's a sample insert. It is printed in English and Spanish. Now, something you might be thinking about if you have kind of already read through your noticing and thinking about what it is that you need to do and thinking about your own, personal or family situation. You really want to keep your application up to date. So maybe you don't even remember when you had applied. Maybe things have changed. Income has gone up or it's gone down. So you really want to keep your information as accurate as possible, including keeping your your income accurate. Now, some of the reasons why this is important is the information that you have listed or you've submitted in your application really helps you get the right amount of help paying for your health and dental coverage. And some of the help that you're getting is coming through advanced premium tax credits. So those are exactly as it sounds. These are tax credits that are coming to you before tax time, tax credits, and they come to you in a form of reduced monthly premiums. So by keeping everything up to date, you have a lower risk of owing money to the IRS when you file your taxes the next year. So with that, I'm going to actually turn this presentation over to my colleague, Melissa, because Melissa's going to actually show you some demonstrations. I've kind of given you the why. Melissa's going to show you the how.
Thank you so much, Nikki, and good afternoon, everyone. So yes, I'm going to actually go into the application and show you how to update your income. Like I said, you can update your application information online at any time by logging into your account and reporting a change. So basically, I'm going to take you through the steps, but just some important things that you need to remember for reporting a change to your income. If you receive an advanced premium tax credit and you report an income increase, you may see a decrease in your advanced premium tax credit if you receive them. If you report a decrease in income, you may see an increase in advanced premium tax credit. If you are now enrolled in a Health Connector plan with no APTC and your income is lower, below 400% of the FPL, and you apply for coverage and help to pay costs, then you may become eligible for tax credits. And also, if you report an income that is at or below 300% FPL, you may be eligible for the ConnectorCare plans. So let me take you through to the steps here. So step one, you want to sign into your account and you want to visit My Eligibility page. On this page, you will see your year, 2022, and the application listed. So here's the example here. So you're in your application. You want to make sure to go to the present year, which is 2022. And you want to click on that. Once you do, so step two, on the My Eligibility page, you click Edit Application under the Actions column. If you don't see this link, skip to step three. So basically here, you'll see your eligibility ID, the submitted date, and then if you keep going, you'll see detail and report a change. So here you want to click on Report a Change. So step four, on the next page, you will be able to choose to update your income information by clicking the Yes button next to Update Income. Then click the Report Changes button to make your update, following the instructions on the screen. So here we have Change Your Information, and actually you can make various changes to the application from this page. But since I'm demonstrating the Update Your Income, it's clicked here, Update Income and Additional Questions. So that's what we want to select. And then you want to click on Report Changes. So from there, when you click on Report Changes, you will be able to go through the application. It will bring you right to the income screen, and it will guide you through the whole entire process. You put your employer information, you will have to list the address, and then you put in your, if you get paid weekly, bi-weekly, how much you get paid before taxes are taken out, and how many hours per week. Once you put in that information, it will guide you through the rest of the application. And then you will basically put in all your information, and then you'll be able to see your eligibility from there. So this is just a really important tool to remember, just in case anything changes throughout the year. It's just very important to keep your application updated.
Thanks so much, Melissa. So your show, so the first thing that you showed us was the landing page for the online application.
Mhm.
And then what you're showing us now is information from mahealthconnector.org. So anybody can access this at any time.
Exactly, yes. You definitely want to create an account if you don't have one, but yes, once you have your account established, you can go in, you put in your username and password, and then you go into your application and you can make changes.
All right, so we wanted to talk a little bit about what's new for this coming year. So some of the ways in which we communicate that to you as members are through member mailings. So depending on where you live and what coverage you're enrolled in, you may have noticed that there are certain changes for 2023. So we just want you to be aware of that. We've had some of the health insurance carriers that are offering coverage on our website have had rebranding. So some name changes, but really important to note that if the carrier had, if they've gone through any rebranding, the plans behind the names have not changed. So as an example, Always Health Partners will be known as Mass General Brigham beginning in January of 2023. Boston Medical Center Health Net Plan is now WellSense Health Plan. And then there are some other types of changes. So in Worcester County, for those people who are enrolled in ConnectorCare plans, beginning in 2023, Health New England ConnectorCare plans will no longer be available in that area. So people who were currently in HNE ConnectorCare plans are going to be moved into a new plan, which is going to be the lowest cost ConnectorCare plan that's available to them. If those consumers don't want to be in that plan, they have the time and are allowed to change plans before January 1. And then lastly, we have the last communication here, the last letter is related to changes to Tufts Premier Health Plans. There was a recent merger or transition. I'm not sure exactly what to call it, but there is a new parent company called Point32, and Tufts Health Plan and Harvard Pilgrim Health Plan are coming together. So for our members who were enrolled in Tufts Premier Health Plan, that plan is no longer going to be available for them beginning in 2023. Instead, they're going to be enrolled in a very similar plan through Harvard Pilgrim Healthcare. So again, same thing, because we are in open enrollment, these are the plans that we're going to be mapping consumers to, but you do have the option to make a change before January 1. Another thing that you'll see if you're going through our online application and our shopping is that we've added quality rating systems, stars, to mahealthconnector.org. So these are basically star ratings that come to us from CMS or the federal government for each health insurance carrier. Now, these star ratings aren't a total picture of the services or the care that a plan provides, but this is something else that as consumers you can use as part of your decision process around whether if you're choosing between a couple of different options. but know that they've got an overall rating. Then they have information about member experience, plan administration, or medical care. There's also something else that we're, again, very happy to report in terms of savings for ConnectorCare members for 2023. So ConnectorCare plans in 2023 now include $0 cost sharing for certain medications that are associated with diabetes, asthma, hypertension, coronary artery disease. Also, ConnectorCare members now have a $0 cost sharing for any PCP sick visits and outpatient mental health visits. So these are great. We're so pleased to be able to have these new benefits available for ConnectorCare members. And, you know, as you're thinking about these medications or even whether or not something is covered by your plan, just always encourage you to check with your carrier and your doctor or your provider, just to make sure that what you're thinking of as a service falls into these categories. So if you're thinking something is $0, just make sure so you know what to expect. Now on this slide here, I'm just showing some examples or samples of the no-cost medications for ConnectorCare in 2023. So again, there's a list of these, but it's not a complete list. So certainly double check with your health insurance carrier. So we're getting to the part of the presentation where we want to tell you a little bit more about how you can compare options and save on Health Connector plans. When you are shopping, there are all types of things that you want to keep in mind to make comparisons about your health insurance coverage. So the first thing I think many of us look at is the monthly premium. So this is that monthly amount that we owe to be enrolled in that health insurance plan. Another thing that we want to look at is the covered benefits. So what services exactly are covered by these health insurance plans? Now, out-of-pocket costs, this is the amount as a member you pay for each service. So whether it's in the form of a copay or a deductible. And then, of course, another thing that you are interested or we're all interested as health insurance carrier members, right, is the network. So is my doctor, are the hospitals or other facilities that I want to go to, are they part of the network? Can I go to them? Will my health insurance company cover those services at that place? So to make things a little bit easier, we have developed this Health Connector Renewal page. And from this page, you're basically able to find all the information that you need about, you know, renewing your coverage for the next year. So we have lots of helpful information, step by step, as well as links to all of the different tools. So I'm going to give Melissa a chance to show this and take you through some of just explaining that page to you.
Thank you, Nikki. So let me take over again. Hopefully I will be able to click on this right away here. Okay, can you see my page?
Yes, but
Okay,
we are brought to the resource download center.
Oh, okay.
So Melissa, I think if you just go to the top, if you go to mahealthconnector.org, the homepage.
Yeah.
If you you can just click on the Health Connector logo.
Okay, thank you. Okay.
Awesome. From the homepage, if you, after our name where it says mahealthconnector.org, if you just put a slash and put renew, it should redirect you right to, yeah, perfect. It should bring you exactly where you want to be.
This is perfect. Thank you so much, Nikki.
No, I think this is going to be helpful for others too, as they're watching this and then they, go home and say, how did I get there again? Just
Yeah.
start at our webpage.
Okay,
Our
perfect.
page.
Thank you. Okay, great. All right, so from here, all right, if you scroll all the way down, you basically have some things to guide you through. Some tools that are definitely helpful, but we want to try the plan comparison tool. So I'm going to click on that. Oh, I'm sorry. Actually, we are not going to do that. We're going to go to check providers and prescription tool. And from here, we can basically click on, so you will see here, Plan Comparison Tool 2023, and then you'll see individuals and families. So we want to continue. Okay, so here we are. So tell us about those who will be covered by your health insurance plan. So here, number one, Massachusetts zip code where you live. So you put in your zip code, and I already have it here, 02302. And then do you qualify for the ConnectorCare plan? So you may not be sure, so you can click on I'm not sure. And then how many people are in your household? You can say 2. And then what is your household expected income in 2023? So I just have an example. I just put here 65,000. So then we can continue here. So here we want to do a provider search. So let's just say you have a doctor that you wanted to continue to see. You have history with this doctor. So you would just put in the name. And then we have, I'll just use an example here. And then it will show the selected provider, Dr. Patel, which is in internal medicine. So then we want to continue. That's our doctor. We want to continue with this doctor. We may not know the facility name. I'm just going to skip this part. And then if you know that you're taking a prescription medication and you know that you have to continue with that medication, you want to put that in because you want to also make sure that is in network with the carrier that you select. So I'm just using, again, another example. You can type in the medication and then you basically have like options to select from. And I'll just pick the first one. But definitely look through the options and make sure you're picking the correct one and the correct dosage amount. And then we want to compare plans. So here, basically what we have is 27 plans available in your location. So we have the plan name, your drug that you wanted to continue to use, your provider that you see, and whether or not it's a network. So for the first example here, this is a carrier, Blue Cross Blue Shield HMO Gold plan. And then if you go across, you'll see the medication that we put in is in network with this type of plan. So that's good. And then if we scroll across again, we see that the provider is also in that network as well. So this is just a great tool to use just to make sure that you're making the best decision possible with what plan that you choose. Again, you can put in as many providers as you would like. You can also put in as many prescription medications, and it will be able to do a search for you to figure out whether or not it is in network. So it's a very good, great tool to use to make your decision.
Thanks so much, Melissa. All right, we're going to try this again. Fingers crossed. Okay. We're doing great. So what Melissa just showed you was the plan comparison tool. So as she explained, you can get information about preferred providers and medication. So that's fantastic. And then I want to talk a little bit about enrollment, billing, and payment. And I covered some of this already, so I don't think this is going to be too much of a surprise. But once you've compared your plan options, it's really, really important for us to emphasize that enrolling into a plan isn't complete until your first premium payment has been made and it's been received and processed. So, a couple of things. If you are looking for coverage for January 1, you're new, you must enroll and pay for that coverage by December 23rd. Or if you're switching plans for January 1, you must do all of that by December 23rd. So during the first week of December, we send a bill for January 1 coverage. So if you are thinking about switching your plan and you want to see those changes reflected in your December bill, you should shop and take care of everything by November 23rd. So that's just something we want to make sure you're aware of. Now, if you get a bill for a premium you weren't expecting, remember you still have until the 23rd to make changes. That's when you can still review your application, update your application. You can shop for a lower cost plan. Now on this slide here, we're showing you payment reminders. If somebody changes insurance carriers, you're going to get a quote that reflects that you got selected a new carrier. We've already talked about submitting payments to start coverage in this new plan. Little things that we want you to be aware of. You will keep the same member ID, even if you select a new carrier. And if you're staying in the same plan, you need to be aware of any premium change and pay that new premium by December 23rd. Now, payments can be made online, by mail, over the phone. We have a relatively new pay by phone option. And then over to the right-hand side of the screen here, you can just see a sample invoice that you may be receiving, you would receive. You'll notice on the invoice here that you are seeing a monthly premium. You're also seeing any tax credits as well as state dollars that might be going towards reducing the cost of your monthly premium. So I will pause here and let Melissa take over just to show you where you get some more information about payment on the Health Connector website.
All right, so I just wanted to go over this real quick. So how to pay. So making payments to the Health Connector, there are 3 ways that you can pay. You can pay online, you can pay by phone, and you can pay by mail. So of course, online, you need to make sure you have an account created and you log into your account and you're able to make the payment that way. You can also make a guest payment, but we only take 2 forms of payment, which is a checking or savings account. And it also mentions here that we do not accept credit card, debit card, or other online electronic payment methods, such as PayPal. So basically, once you're able to shop for your plan, an important date to remember is the 23rd of every month, because that's when your payment is due. So once you make that payment, your health insurance becomes effective the following month on the 1st. So for example, if you make your payment on November 23rd, your coverage starts December 1st. If you make your payment on December 23rd, your coverage starts January 1st, and so on. So that is an important date to remember. And Also, your enrollment isn't finished until you check out your plan and make your first premium payment for your coverage by the due date. If you miss this deadline, the earliest date your coverage could start is the first day of the following month. So just for you to keep that in mind.
Melissa, and that's a real thing, right? I mean, that is like something that we've heard members reach out to us about, like if they miss that deadline, really trying to figure out how they can get coverage. But depending on the date that we get they send the payment, we get the payment, they may not be able to start until, let's say, February 1 or March 1.
Exactly. Yes, it's very important. So here we have the payment portal. You can either find by exchange ID, which is your member ID, which you would find once you're in the application, you are provided with an ID, or you can find by social security number. Basically, you would have to fill out the required fields. You would have to put in your last 4 digits of your social security number, your last name, and your date of birth and your zip code. And from there, you would be able to access the payment portal and be able to make your payment that way. But once you complete this portion, you will be able to have access into your account, and you will be able to basically put in either a checking or savings account. You do have an option of auto pay, and you would put in your information. It's straightforward. You put in your billing address, put in all the information that way. And then once you put that in, you will get confirmation that the information was received, and that you would receive email confirmation within 3 to 5 business days, and that you would basically be all set with your payments.
So here, we just wanted to give you some background information. And we know this is pretty detailed, but we thought this is really good for people to understand. So when someone is found eligible for Health Connector coverage, they don't automatically start receiving health insurance benefits. So you've heard us say that you first need to shop, you need to pick a plan, enroll in a plan, and if a premium is required, you must make that payment by the 23rd of the month. Now, once someone's enrolled in a plan and made a payment, if you owe a monthly premium, the Health Connector sends an enrollment file. So it sends something technically over to the insurance carriers. And that information is used to effectuate coverage or to start your health insurance coverage. So this information confirms your name, other information, your enrollment in that particular health insurance plan with that carrier, and your coverage dates. So this is important to have, and it takes some time to get there before you can use your coverage. So I really think we wanted to make sure that people understood that it doesn't happen immediately, but within a couple of days, that information is received and processed. Now here we have get an estimate tool. If we have been basically spending all this time talking to you as if you were already a member, but some people might not be a member. Somebody might just be saying, well, I don't know if I'm eligible for coverage or not. So I am going to show you this quick video. If you go to our homepage, mahealthconnector.org, in the upper left-hand corner, if you click on Get an Estimate, you would get to the screen. So what's happening is someone's going to our homepage, they're clicking on individuals and families. They scroll down, they pick the coverage year, type in a zip code, enter some income information, and also enter the number of people in the household, putting in the age of each person. Click Go to Results. As I mentioned, this isn't an application for health insurance coverage, but rather just a quick estimate.
Okay. So I'm right here. I'm actually going to start over from the very beginning. So here at the home page on the top, if you hover above get an estimate, you will see individuals and families or businesses. You definitely want to click on individuals and families. And once you click on there, basically you have to answer a few questions about your household to see if you qualify for savings. So it's pretty straightforward. You want to just choose your coverage year. So I'm just going to pick 2023. Then I'm going to enter a zip code 02302. I'm sorry, I'm going to pick 2022. And then I want to enter what you think your household income will be for the year. So I'm just going to say, I'll give an example, 55,000. And there's 2 people in the household. We'll pretend they're a married couple, 35 and 32. This is just an example. And then you want to be mindful of each person. You want to select whether this person needs coverage, this person is pregnant, or this person is disabled or blind. So for both of these people, I'm going to say that they need coverage. So then now I'm going to go to my results. And this is just a reminder that this isn't an application for health coverage. That's fine. So I'm going to continue. And then now we have the estimated eligibility for this couple. So based on what you told us, your household may qualify for an advanced premium tax credit to help lower your monthly health insurance premium costs. So your maximum tax credit amount is $443. You are eligible for silver plans with monthly premium as low as $256.02. So now it's further broken down for each person, each household member, and their potential eligibility. So both of these people here are eligible for the Health Connector plan with advanced premium tax credit. So this is great news. So now what we want to do is preview the plans. Again, everything is broken down. So your estimated savings details. So here you have the FPL for this household, which is 315.73%. And then you have the monthly APTC for taxed household, which is $443. Again, as you had seen before, we have the carrier, the plan name, coverage level, monthly premium, APTC savings, and what you would pay monthly and your savings per month. So this is a great way for you to see how much you'll be saving per month, which carrier you would be interested in, and how the plan is broken down, the coverage level. So this is just a great tool to do before you even apply, just to get an idea of how much you'll be saving. So once you take a look and see, and everything looks great, you want to go ahead and apply, you have the option here to apply now. Or if you wanted to start over, you made a mistake and you want to go back, you also have the option to go back and put in new information. So it's a really helpful tool.
Nikki, Melissa, all of that information, so helpful. The demonstrations, so incredibly helpful. This one question kind of does go back to use of the provider search tool, but I think it's an important question, and I think we can offer more information on even how to find help if maybe the provider search tool doesn't do it all for you. But essentially, somebody who might have, specific health needs, if they're a current member and they're finding that maybe their current plan isn't suiting their health needs, what is the best thing for them to do? I know you reviewed the provider search tool, but if there are specific health needs, maybe they can use that tool, and you can kind of explain it quickly again. but also just other help that might be out there for these individuals as they shop for a new plan.
Sure. So one of the things, so a couple of things. Every health insurance carrier has a file on our site as part of their health insurance, as part of the benefits descriptions. It's called the summary of benefits and coverage. So if you're looking and you want to do a comparison and you really want to see the benefits and then the just costs of the different services and compare those two, you can certainly take that, print those out and review that information. That's one way to do it. If you want some one-on-one help, you can contact our customer service center, or you can reach out to a local navigator from mahealthconnector.org. I went to the resource download center and I chose Find Local Help. And here you basically have an opportunity to choose certified application counselors, MECs, etc. In this instance, I want to choose a navigator because these are people that are available to help, and they're able to offer help in different languages. So this tool is pretty powerful. Based on the address that you put in, you'll be able to find a number of different locations that could help. Just practically speaking, because we're in open enrollment, it's a really great idea to call ahead, schedule an appointment. These folks are able to help you in person, over the phone, even via Zoom. So whatever is going to be best for you.
And one more thing I just wanted to mention real quick. We also have a plan description for each carrier. There's a little link. If you hover above it, you can click on that and it'll give you a brief description. And also you can do a side-by-side comparison, which is also really helpful to see which what each carrier has, and you can pretty much compare each and every one of them. So that's really helpful as well.
Awesome. Thank you, Nikki and Melissa. And one last question before we jump off. If somebody, maybe they haven't been enrolled with us for a while, or they've logged in, started an application, never finished, but they forgot their login credentials, can they just create a new application and start over?
No, please don't. So if you started an application, maybe never finished it, or started one, maybe ended your coverage, we would really, it's just so much easier for you if you contact customer service. If you need help resetting a password, they can help you. But really, if you could go into your application and just update it with all of your current information, that will just make things easier for you. So there isn't any kind of duplicate information out there about you. Melissa, is there anything? Yeah, I was going to say, if you have very practical knowledge about this, any guidance you'd want to give?
One more thing I wanted to mention actually is if you duplicated an account, the duplicate account will not let you go further with your application. It will allow you to start the application, but you won't be able to complete it. So it's very important that we do not duplicate accounts.
So if somebody does do that by accident, maybe they forget they've applied, that might be what's catching them up. And so they should reach out to our contact center to maybe get assistance. Great. Thank you. That's really helpful to know as well. And one last thing, if people enroll in a new plan during open enrollment, do they have to keep their coverage for the entire year? Or, if they don't know what circumstances might be in the future?
Yeah, so circumstances always change, right? So basically as a consumer, you're entering into a contract with us and the health insurance carrier for a year, which means that coverage they're saying that they're guaranteeing that you'll be able to get these benefits for 1 year at this price. Now, if something happens, something changes in your life and you no longer need coverage, you just need to reach out to our customer service center before the 23rd of the month and let them know that you no longer need coverage beginning on the 1st of the following month. And that's it. You will stop paying premiums. You will no longer have access to that coverage. but you do need to let us know so that those premiums don't accumulate.
Great. Well, those are all of the questions that we have for today. But again, thank you so much for such a thorough presentation. And again, open enrollment, it began on November 1st. It runs through January 23rd. Make sure that if you need coverage for January 1st, 2023, that you complete your application, update your application, select a plan, make a payment if you have one by December 23rd. But again, open enrollment does continue until January 23rd. So Nikki, Melissa, anything you want to leave our audience with?
Just a big thank you, and reach out to our customer service or our navigators if you have any questions or need help on your way.
Great. Well, thank you and take care, everyone. Thanks for joining us today.